Okay, today's session is about taping the sports ankle. So for ankles that have had a sprain, so a lateral ligament sprain, we're going to look at trying to stabilize this ATFL, this anterior tibiofibular ligament, so this one here. So with my patient here, what's happened is she has rolled her ankle that way, so she's gone into inversion and sprained her lateral side of her ankle, and so this ligament here has been torn a little bit, and we need to stabilize it up for her to be able to do some sport work on it. So what we're trying to aim to do is teach you how to tape an ankle to stabilize this side, and for this injury she's also actually damaged this ligament as well. She's gone and compressed that side, and she's pretty tender there as well. So we're going to stabilize both sides and show you what you need to do for this. So if you can imagine, what you need to start with is an ankle that's nice and clean. Now if you guys can, what you need is you need a bit of a kit. You need something like this, which is tape remover to clean the skin, especially if it's greasy. You also need some Therafix or some sort of porous underwrap. Now this stuff is great for people who get rashes to tape. Now usually we don't need this. We only need your rigid tape, which has got a serrated edge, so it's a nice serrated edge so you can rip it. Okay, that stuff is zinc oxide tape. Now skin doesn't like that, but normally that's only on the skin for about 3 hours when you're playing sport, so put that on, no problems. But for this one, we want her taped for the whole time for about 3 days. The skin's going to get pretty gnarly if you have that on for 3 days. So we're going to have some underwrap, okay, and you need some decent scissors. And I don't mean sort of normal scissors, I mean some decent scissors to cut tape. These are some Kinesio scissors, so these are awesomely sharp, these ones. So if you can get yourself hands of that, great. So here's some strips I've cut earlier. So what we're going to do is I'm going to show you how to pre-wrap tape. So we're going to use some hypoallergenic tape. Just keep your foot up there, my dear. You can see she's got a bit of a blister on her toe, this one, but that's okay. What I want you to aim for is keeping that foot in 0 degrees dorsiflexion, or like a 90-degree angle here, and she needs to keep that there with her tib ant. And you're going to cover all the areas that the brown tape, or the flesh colour tape, is going to be in contact with. So you're basically putting a barrier, and this is a porous tape. This is a barrier between the brown tape and the skin. And you just need to make sure it's going to cover, it's going to go high enough up the calf. Okay, and I would aim to have, this is 50mm tape by the way, so 50mm this way. I would have half it on this side, and then you're going to cover the other half at the front. So half over the fibula, lateral malleolus, the other half coming through the front. It just gives you enough coverage for the skin. Try not to get any crinkles in it. That can irritate the skin a bit. It doesn't feel too nice when you've got crinkles when you're trying to run around on the sports field. And so keep it 9 degrees, getting it up into there. You can be pretty quick with this. The main taping is what you've got to be slow and precise with. So that's covering your areas that are going to be stirrups. Then you've got to cover some more area through the front. I like just actually, if you don't mind wasting a bit of tape, I like doing this, where you're going to go in the region where you're going to tape it. So for this one, now this is mimicking what I'm going to be doing with an ankle lock. So coming from the front on a 45-degree angle, going around the back of the calf, so the back of the Achilles, making sure it doesn't crinkle. So when you come here, you see how it's pretty sticky, this stuff. When you come into this point, what you're aiming for is making sure that when you come around, it's on a 45-degree angle there. Don't get that crinkle like I just did there. Okay, so that's coming around there, and then you can just sort of even off around there. That doesn't really matter too much because we're going to add some more up. This is where your scissors come in handy. Switching that off there. Throw that bit away. You're going to add some more to cover the rest parts of the skin. So just grab a bit for the front of the shin there. Remember, this is hypoallergenic tape. It's got a nice porous feel to it. But even being on the skin for more than 3 days, some people can still get a rash this. And this is, if you're one of those people that gets a rash to even this tape, I recommend you use a foam underwrap, which is this stuff. So It's the foamy stuff, and that's not as great because it's not as rigid, but hey, if you're getting rashes, you're going to have to use that. And then don't forget the back. A lot of people, they'll tape up their ankle and they'll miss a little bit of skin right on where that Achilles is, and that's where they get the rash, and they have to take all their tape off. So come around this side, just making sure you sort of almost putting it down like a bit of sellotape, and then round the back of the calf there. But just be careful with the heel too. Make sure it's not too bunched up around there. And you'll see we've met it on this side. Perfect. Up into there. Okay. And I can see she's just missed one bit. I'm being pretty pedantic about this, but I don't want her getting a rash of that tape, so we're going to cover it fully up, and that's beautiful. Okay, so she's got most of her ankle taped. It looks like it's sort of in plaster a bit. That's going to be really helpful for her when she is having this tape on for 3 days. Let me just put one on there. Okay, perfect. So back into here. So taping. Now it is hard doing this yourself, so this is why we're doing a video of this, so you can get someone else to do it, because otherwise you need about 4 hands. With this tape, you want to get the full length out of that roll, really, or at least 3/4 of that length. Start off. Now sometimes you can put a lock on here. We've already got tape here, so we've got something to grip on. If you haven't got tape, you put a lock on at the start. We don't really need to do that. So we're going to come in from the top here. Now this part here, you've already got to anchor down. Okay, so I'm on the back side of that malleolus. I've got my ankle at 90 degrees, and what we're aiming to do, hold it there and pull it tight so it's taut down there. Okay, and just get it vertically down there. This is called a stirrup. Stirrup number 1. And you come up to the same length at the top there. Okay, so hold it there. Just on this side, just push that down. Okay, so it's really nice and tight down through there. And this is the trick here. She's at 90 degrees. If you watch this, you watch the ankle, I can just gauge how much leverage I want. If I really want to ram her up into eversion, I can do that. Or if I just keep her neutral, a bit of tension on, and then I push it down above the lateral malleolus. Okay, really get that down, and then push it down below the lateral malleolus. So it's really taut over there. Now this is perfect for your lateral ligament sprains, this one here. You have to do it for your ATFL, your anterior talar fib, but it's really good for your lateral ligament here. And then you do another one, and this is going over half over, so half over the first one. Does that make sense? So here, if you look at that, I'm not going here, I'm going half over. So I'm reinforcing, come up in here, reinforcing the middle part of that, which is over the bulk of the malleolus. Really good for this deltoid ligament here. And then coming up here, the second stirrup, and getting it, yeah, that's it. Getting it to make sure she's not too far into dorsiflexion, just 0. Putting that tight, locking it down, and there you go. Okay, so now that's your stirrups. And then you need to, for an ATFL sprain, this is good for lateral. So she sees locked there. She can't move that now, but I can still move her that way. So I want to stop that movement as well, because we don't want her rolling into inversion. So another one starts, again, you've seen this part here. We've already seen, you can see where I'm going to start on that 45 degree angle. And it's about sort of a third of the way up the tibia there. And I would come about there. So what's happening is there's your lock point, lift the foot up, make sure she's in dorsiflexion, coming above the lateral malleoli, round, now it doesn't have to be taut, this is just normal tension, above the heel, so around the back of the Achilles. So when you come around this way, you're on a 45 degree angle on the medial side of the calcaneus. Okay, and that gives me something to lock. Okay, so trying to get that subtalar lock. And when I come around here, you've got to make sure you miss the fifth met, I should say. There's the 5th met starting there. You can't come over that, it's going to hurt. So round, just follow where the stirrups are, normal tension, and here's the point where you're going to crank. So from here, what I want to do get really nice and no crinkles. Get that foot in 90 degrees, and they're going to tighten up over there, down it goes, okay? And what this is going to, if you watch this, she can't move now. That's really going to stop her rolling her ankle. There's a little bit of give because tape moves on the skin, but it's going to really stop that movement, give her a lot more support. She's going to feel a lot better when she's running around the netball court or the footy field or whatever you're doing. Now, just to add on this one, so that's for a lateral ligament sprain. If you've got a deltoid problem over here, or you've had some bone contusion under here, which is a bit of a problem, you can also go the other way. So I would just go 45, exactly the opposite of what you just did. Throw it around there. Try and follow the same 45-degree angle. Now this one doesn't need too much, just coming up. And this is the one you've got to be careful of. If you come too hard over this tibialis anterior tendon, it's going to start causing blisters, and you don't want to do that. So you want to sort of pull up into there, so you can see how I'm basically reinforcing it to stop it rolling in. Once you get to there, then slacken off a little bit, so you're not too taut over that tibialis anterior muscle, otherwise she's going to come back and she's going to say, I've got a massive blister and I can't tape anymore. So there's your lock. Few pointers for this one. If this starts getting irritable, split the tape. If people don't like it, sometimes they come into dorsiflexion, they don't like it, split the tape. Make sure though you lock off the top. So if you lift your heel up, what I like doing is locking off the top. Okay, this does not need to be tight. You cannot cut off the calf. Okay, so that is just normal. No tension on that. And for people playing sports, so this is good for walking. So if people playing sport, I tend to get another one just in here, just reinforces a little bit more. Okay, and then you